What's going on, guys? Welcome back to another video. I'm currently headed to my last shift in the emergency department here in Utah. I'm not quite done with my emergency medicine rotation, but I am going to be finishing up part of it here in Utah, and then I'm going to be headed to California on Sunday to do 2 weeks at one of the residency programs out there. I reached out to one of the programs out there, and the program director told me to come out and check out the program as a third year in the off chance that, I don't like it and I don't have to waste an audition rotation come fourth year, which I don't think is going to be the case, but I thought it was pretty awesome that the program director wanted me to at least come check it out, even as a third year medical student. And so whenever I tell someone that I'm planning on becoming an emergency medicine physician, they always want to know, like, what's the craziest thing that I've seen in the ER? And so I wanted to share that with you guys today. And so we had this young 15-year-old male come into the ED with a pole sticking through his entire chest, out through his back. And so the story we got from the paramedics was he was in a car crash. They essentially went through some sort of fence, and one of the fence posts, one of those metal hollow posts, impaled this kid right through, I think it was the right side of his chest. So it wasn't like directly through the middle. It was definitely pretty far off to the side, which ultimately ended up saving his life. So he rolled into the emergency department. He was sitting upright on the stretcher. Keep in mind, this guy was fully awake. He was talking. Yes, he was in some pain, but he wasn't bleeding out anywhere. His vitals were stable, but it was just kind of crazy. This huge Polynesian kid sitting upright in a stretcher with this like 5-foot pole going through his chest and out through his back. So he was unable to lay down, obviously, on the stretcher. In this situation, you want to kind of see where the post is going through. Is it going through any major vessels, going through his lung, through his heart? And so obviously he couldn't fit into a CT scanner because of this giant pole sticking out of him. So we got some x-rays, and luckily he didn't have like a pneumothorax, like his lung wasn't collapsed. He was breathing fine. His oxygen saturations were fine. And like I said, his blood pressure is fine, which was reassuring that he wasn't bleeding out anywhere, both externally and internally. Now, we didn't really know if the pole was kind of clotting off some of those blood vessels. And so essentially he went up to the OR, where the surgeons decided to simply pull out this metal pole from this kid's chest. And from the report, no major vessels were damaged. They simply removed the pole. And obviously he had this giant, void in his chest wall. And I think it's important to know that this kid was pretty big. This big Polynesian kid, played football in high school. He probably played like O-line or D-line, so he had a lot of subcutaneous fat. And the pole was going through his chest wall, but it was more like under his armpit, his axilla. And so the pole actually didn't enter his thoracic cavity. It just went through that subcutaneous fat. And so this is probably one of the only stories you'll hear about where it pays to be a little bit overweight, because it potentially saved his life. Because just a few inches more medial, he would have for sure punctured his lung. He might have punctured his aorta or parts of his heart, and it could have been a lot worse. So in the OR, it sounded like they just took the pole out, they sutured him up. He was sent through the CT scanner at that point to make sure we weren't missing anything, and luckily he did just fine. So this story isn't very gruesome. It's just kind of crazy when you see someone come into the emergency department with a pole sticking through their chest. But I do want to pose the question to you guys, which many of you probably already know the answer to. Why do you think we didn't remove the pole in the emergency department? So I'll let you guys kind of think on that and let me know your answers down in the comments below. So now that I'm kind of finishing up my rotation in emergency medicine, I've done about 6 weeks so far, and I have 2 more weeks, like I said, that I'll be finishing up in California. I wanted to kind of share some tips and pointers for anybody that is wanting to go into emergency medicine or is planning on doing a rotation in emergency medicine. I'm pretty sure the rotation for emergency medicine is required, especially as a 4th-year med student, but that definitely varies from school to school. But you have a pretty good chance of having to do one of these rotations, whether you like it or not. The emergency department is unlike any other department or rotation that you're going to experience. It's very chaotic but laid back all at the same time. The doctors are super cool, they're super chill. And so one thing I really want to emphasize is, as a student in the emergency department, you want to volunteer or be proactive in seeing patients. So whether you're assigned a doctor to work with or you're just supposed to pick up patients on your own, be very proactive in going and seeing patients. It's super fun, you guys. It's a lot better than seeing patients in other specialties because it's like detective work. These patients are coming in for a specific reason. Your job is to figure out if this specific reason is life-threatening, or if you can kind of rule out the life-threatening things and send them home. I think the biggest issue ER docs have with medical students, and if you guys didn't know, my father is an emergency room doctor, so I talk to him a lot about this stuff, as well as my preceptors. The thing that really irritates them is students that don't go and see patients and have to be told to do everything. Now, the doctors don't expect you guys to know everything. They don't expect you to know how to work something up. In most cases, in some things you probably should know what to do, like get a chest x-ray, get an EKG if they have chest pain, stuff like that you probably should know. But they're not going to expect you to know which antibiotics to send them home, or what the dose of ketamine is, or how to cardiovert a patient. Those are things that you're there to learn, and they're not going to expect you guys to know that on your first day. But what they do want to see is a willingness to learn and a proactiveness to go and see patients, because they know you can take a history, they know you can do a physical exam, and if that's all you can do, that's totally fine. The other thing that's super important in the emergency room is coming up with a broad differential. So there's so many things that patients can have, and there's so many different presentations of those specific diseases and pathologies. And the ER doctors want you to show them that you're thinking of all of these different things that your patient could have. Even the things that are very unlikely, as long as you verbalize it and say, hey, you know, it could possibly be this, but this is way low on my differential because of this, this, and this, then they're going to appreciate that because they know you're thinking of all the different things that your patient could have. The other thing that's going to be very important during your rotation in the emergency department is following up on the labs and the tests that you guys order for your patients. Make sure you know what the physician is ordering, whether you're suggesting it or if they're putting in their own orders. Make sure to follow up on the chest x-ray, on their CBC and other blood work, on their EKG. Usually your attending is going to have up to 15 patients in the ER. And so if you can help them kind of stay on track and remind them like, hey, this person's blood work just came back and it looks normal, then they're really going to appreciate that. But make sure when you come and let them know, you have at least thought about, next steps. Now, there are a few resources that I highly, highly recommend that you guys get, whether you're going into emergency medicine or not. These books are going to be super helpful for you guys in any specialty. And so what you want to do is you want to join EMRA, so EMRA. You just join it online, and what they're going to do, they're going to send you a set of books that's included with your membership. And one of them is going to include an antibiotic guide with very common things that require antibiotics. And so I use that thing all the time. I even talk to new attendings that say they still look at it every once in a while. So it's a really good book to have, especially if you struggle with antibiotics like I do. And so that's one of the books that they're going to send you. Another book they're going to send you is similar to a book I mentioned in my most recent video. That book was called Pocket Medicine, but this one is very similar, only it's going to apply more to the emergency room. So I forgot what this book is called, but I'll make sure to post it in the video. But it essentially goes by problem, and it tells you how to work it up. So what blood work do you want to get? What imaging do you want to get? And then once you figure out the diagnosis, how to actually go about treating it. Do you need antibiotics? Is it just supportive care? Do you need to admit them to the hospital? So it's super good. I highly recommend it. And all of these books, they come with this membership from EMRA, which is only like, I think it's like 70 bucks or 80 bucks. So not super expensive. And if you end up buying it like halfway through the year, then they only charge half the price and you still get all of those books. The other book that it comes with is kind of a quick guide to EKG readings. So if you're not good with EKGs, that will be super helpful. But these books are super helpful, and I highly recommend them for an emergency room rotation. The other things that you may want to brush up on are suturing. So suturing in the ER is a lot easier than suturing during your surgical rotation. You're not going to be expected to do hand ties or subcutaneous or intradermal sutures. Everything in the ER, for the most part, are simple interrupted sutures. So just kind of brush up on doing that, doing it correctly, doing it well. Know which types of sutures are non-absorbable versus absorbable. I always have to review that. But if you're in a bind and you need to suggest something, you can always suggest Proline, which is a non-absorbable suture. And you're normally only going to use either a 4-0, a 5-0, or a 6-0. A 6-0 is going to be used for a lot of facial lacerations, unless it's in a high tension area. Other than that, for like legs and arm lacerations, you'll probably use like 4-0 Proline. Just because it's a lot stronger. And then you'll also want to brush up on or actually learn different type of splints. So if you're going to put a splint on an ankle or on a wrist, there's different ways of doing that. So kind of look up those things. And then you can also look up things like how to reduce a shoulder or a hip dislocation. Because granted, you're probably going to see some of those and be helping out in reducing those. So it might be good to know a few of those techniques as well. Now, a few things that will probably help you stand out on your rotation in the ED is knowing a few different calculators or criterias or whatever you want to call them. There's this thing called MD Calc. It's an app. I'd highly recommend getting it. There's a couple calculators on there called the Wells criteria or the PERC criteria. And those are to help you kind of rule in or rule out a pulmonary embolism. So a lot of people come in with shortness of breath, and you always want to make sure it's not a pulmonary embolism. So those calculators are really good. You also want to know what the heart score is, which is another calculator. That's also on MD Calc, and that can help you know if someone's having an MI. The other things you guys should know are the SIRS criteria for sepsis, how to manage sepsis, and then also DKA, and how to manage DKA. If you get those books that I was just mentioning, it has how to manage DKA, how to manage septic patients. So it makes everything a lot easier. So guys, as you guys can see, emergency medicine is not as easy as maybe some people think it might be. There's a lot of things to know. There's a lot of things to make sure that your patients aren't going to die from. And so you just have to have this vast knowledge of all of these different things. You don't need to go super in depth in a lot of them, but you definitely need to be able to recognize them and diagnose them and get their treatment at least started. So if you guys have more questions about emergency medicine, happy to answer them. Just throw them in the comments below. Granted, I'm just finishing up my 3rd year of medical school, and I don't know nearly everything there is to know about emergency medicine, so definitely keep that in mind. Hopefully you guys enjoyed the video. If you did, give it a like, subscribe to the channel, and I'll see you guys in another video.